Hi, I'm Philippa Page and I'm a sheep vet and I work at Flock Health Limited. And today in this webinar we're going to be talking about neonatal nutrition and newborn lamb care. Achieving low mortality in lambs and a successful lambing is based around some well tried and tested principles of neonatal nutrition and their care. So birth weights is definitely one of those principles. Colostrum management and quality and intake is really important, and then also is the challenge of disease and how that it can possibly cause problems within the lambing shed. So these are the topics that we're going to cover in this webinar. We're going to look at how planning, protecting and prevention will achieve good lambing success. We're also going to look at immediate post-lambing care and also a checklist based around what we should be doing before we turn lambs out. So based around the principles of neonatal nutrition and lamb care, these three areas are really important, particularly concentrating on colostrum. We've got loads of evidence now and lots of practical evidence where ensuring that the correct amount of quality colostrum has been taken in by the lamb will lead to reduced mortality, reduced incidences of disease, and that lamb going on to become healthy and productive. So we've got protect, plan and prevent, three different areas that we need to look at. We've talked previously about nutrition and body condition score and the importance upon that there is in developing quality colostrum of good quality. Planning to make sure we've got the diet correct and that we've looked at the forage and we know what shortfalls we need to make up. And also planning to maximise colostrum intake and checking the colostrum and keeping records that we can use year on year to improve things, and then preventing actual the challenges and risks from disease, so looking at bedding and looking at hygiene and disinfection, etc. All three areas which lead to improved lambing success. So we've got targets for what we're looking at from a birth weight point of view for our newborns, and meeting those targets means that we will have lambs that are less likely to die. And we've got good research surrounding that, and we know that birth weight is driven by nutrition and body condition score and how much the ewe eats in the last few weeks of pregnancy. The targets we're looking at really for singles over 5 kilos, a twin over 4 kilograms and triplets over 3.5. Lambs that have achieved those good birth weights will have good levels of internal brown fat, which is used importantly for thermoregulation, so it's used as an energy source for those lambs in that crucial period to supply them with enough get up and go to be able to get up and suck the ewe, and also to protect them in situations where the temperature, weather, adverse conditions may cause them to need more energy. It also means they've got more circulating blood glucose, which helps, and then hence minimising the risk of hypothermia and starvation. So birth weight is really important and something that we need to record, because if we're having issues with birth weights, for example, abortion will cause lighter birth weights, underfeeding of the ewes and condition score will cause light birth weights. So it's something that we really need to record so that we can plan for the next lambing if this has been a problem in the current season. So we've mentioned colostrum, and everybody will have heard of colostrum by now and how important it is. And we want to maximise the intake of quality colostrum. So we can really, in terms of how much the lambs need, we want the first feed to be within the first 2 hours. Really, we are competing. There's a race going on between how much colostrum we can get into the lamb and potentially how much bacteria can get into that lamb and start to cause problems. So the quicker we can get colostrum into them, the less likely they are to succumb to infection from bacterial challenge, which then goes on to cause conditions such as watery mouth, scours, joint ill, dysentery, etc. So a feed within the first 2 hours. In terms of quantity, we're looking at 210 mils per kilogram in the first 24. So for a 5 kilogram lamb, we're looking at a litre of colostrum needs to be taken in the first 24 hours, with the first feed of that happening in the first 2 hours. So eucolostrum contains around 50 grams of antibodies, so IgGs per litre. And antibodies are what help the lamb form its immunity, because there is no transfer of immunity over the placenta. It all comes from the consumption of colostrum. So we want ewes that have got good quality colostrum, because for example, a 4 kilogram lamb needs 20 grams of IgG for good passive transfer, so for good immunity, and that equates to about 400 mils of ewe colostrum in the first few hours. The ewe colostrum at lambing time is at its peak, so it's at 50 grams per litre at lambing time. It then starts to decline over the next 24-36 hours, and so does the ability of the lamb to absorb that colostrum. So speed is absolutely of the essence when we're looking at newborn lambs and determining whether they've had a feed or not. So in terms of a lamb suckling for a good 10 minutes will be getting a very good feed of colostrum. So if we obviously haven't got time to stand there and watch, but we need to notice whether they are actually latched on properly and whether they actually are sucking successfully and positively. A lame or a thin ewe won't be able to feed her lamb properly. So we need to look at what lambs are at risk, and particularly a lame ewe, she'll very often, when they've lambed, they'll just want to sit down. So important that we get her treated, as we've mentioned previously, and important that we keep her on her feet. So looking at whether we need treatment there, pain relief and antibiotic possibly, depending on why she's lame, to make sure that in that golden period after lambing she's able to stand and feed her lambs. So we're trying to maximise how much colostrum we can get into these lambs. From a quality point of view, we can test it really easily and cheaply with a piece of equipment called a refractometer, which is there in the picture. We need literally a little drop of colostrum onto this refractometer. You then look into it and look up at the light, and it will give you a reading. Very straightforward, and they only cost around £20, and they are well worth it. Particularly if we're not sure about a ewe, whether she's got enough colostrum, or if we want to harvest it from that ewe. So that is a good bit of kit worth buying, and it can be found easily on the internet, on the shopping sites there. So speak to your vet or consider looking at getting that bit of kit this year. Sometimes there are situations where the supply of colostrum needed for those lambs is not available. So the ewe may be sick, she might have metabolic disease, or she might have died, or she may have mastitis, or you may go to check her udder and find that one side's blocked. So a variety of things that make you realise that she's probably not going to have enough colostrum, or the supply is not good enough. You may have tested it with the refractometer, and it may just not be up to standard. So there are options that we've got to supply those lambs with colostrum. The very best alternative is colostrum harvested from another ewe. This is a great job to get a student to do. If you've got a lambing student, is to go and harvest colostrum from a single bearing ewe as close to lambing as possible, because we know that the levels of IgG start to drop away from the point of lambing. So a single bearing ewe as close to lambing as possible, provided her lambs got up and had a suck. Harvest that. It needs to be clean, it needs to be, hygiene's everything, it needs to go into a very clean container, especially if we're going to store it, and definitely if we're going to feed it. We don't want any muck in there, any fleece, any straw. It needs to be clean, because all of that will be going into will make its way into the lamb. There are products out there now that can help you harvest the colostrum, where it goes into a really clean, hygienic bottle, and you use a pump, like a hand pump, to extract the colostrum. They work really well, so they're worth looking up online if anyone wants to look for those. So eucolostrum is by far the best alternative, and at all costs try and harvest some, even if you don't need it, and then store it. So it can be stored in the fridge for up to 7 days and then fed, or it can be stored in the freezer for up to a year. Just make sure that when you thaw it out, you don't use a microwave, because that will damage the antibody protein, and that you either let it thaw naturally. If you've frozen it in small enough packages, that'll be fine, or you can use a water bath to defrost it, but not boiling hot water, just warm tap water. So yeah, best possible scenario is eucolostrum. We can use goat colostrum and we can use cow colostrum. They have an increased feeding rate, so you need to feed at least 30% more, because these contain lower levels of antibody and lower levels of energy and protein, so then you need to feed more of those. There are disease risks. Johne's disease in particular can be transmitted by feeding the colostrum from infected cows or goats, so that's something to be aware of. Try and know the history of the farm. And also there is a risk of certain cows produce components that can induce hemolytic anemia in lambs, which basically will kill the lamb. So if you're going to feed cow colostrum, it needs to be from a number of different cows mixed together, so that the effects or the risks of that are diluted out. There are powdered supplements available to help supply definitely a good energy source and a good protein source. These can be used to prevent hypothermia in the lamb, and they can be used alongside a little bit of eucolostrum if you've managed to harvest some. They're not a complete replacement on their own, but they are good supplements to use in the event that you haven't managed to harvest any other colostrum. Ultimately, colostrum is gold, and the efforts should be placed into trying to harvest that where possible. Whilst it's really important that we've got the colostrum of good quality into the lamb, it's also really important that we look at the environment in which they're in as a whole. And the more we can reduce the challenge of infection, the more chance that lamb full of good colostrum has got of surviving and not developing infection. So the bacteria that cause infections live in the environment. They're in the feces, they're in the straw, the beddings, and also they can be transferred to the fleece of the ewe, her teats, hurdles, buckets, anything that's in the environment, basically. So we're trying to reduce that challenge. So visually reducing obvious contamination will be very helpful. We might look at crutching out ewes if they're really dirty. We want the areas to be dry, so the drier the environment in terms of the straw, the bedding, the slower at which the bacteria can grow and develop in those areas. So maybe concentrate on the lambing areas in the shed and making sure that they're well bedded, and then monitor the other areas. Could be a way of using straw, etc., cost efficiently. We want to make sure that we clean anything that we use, so buckets, our hands, which are really important, stomach tube equipment needs to be cleaned in soapy water, possibly disinfected and dried before we use them again, so that we're not spreading infection and we're not spreading bacteria. The individual pens need to be cleaned, and make sure that the water buckets are kept clean, and the bottom of the hurdles aren't filthy from climbing in and out of pens, etc. All areas which can increase disease challenge. But really, we want to turn them out as soon as we can. There's far less disease challenge from a bacterial point of view when they're outside in the field. So the quicker the turnaround time we've got, the better. So that's something that we need to aim for from a reducing disease challenge point of view. Immediate post-lambing care, particularly for indoor lambing flocks, must centre around what happens to the navel. So the navel is a really good way of bacteria, bugs, environmental pathogens to actually get into the lamb and cause disease and cause them to be sick. So treating that navel is really important, as is, you know, making sure that colostrum gets in, because the other route of infection into the lamb is through its mouth. So with the navel, treatment as soon as possible after birth, so ideally within 15 minutes. Yes, the ewe will lick this off, but just the fact that it's got on there and it's started the drying process is what we're trying to achieve. And then again, really, that treatment can be repeated within the next 4 hours. So usually it fits with when the ewe and lamb's moved out of the pen, out of the yard, back into the pen, and then she can be retreated. What we want to do is to get that navel to dry. So the sooner it dries, the less chance there is of bacteria being able to colonise that navel tissue and move up towards the body and then move into the body. So we're almost racing the bugs in the same way that we're racing the bugs when we're trying to get colostrum into the lamb. So the best treatment is a strong iodine solution, which is at least 10% with an alcohol base, and the alcohol helps dry that tissue. And it can be applied by spray or by dip. But what's important, no matter what method is used, is that the whole of the navel is treated, not just the top where it touches the skin, but from the very end where it appears all the way up towards the body. The whole thing needs treating with iodine, and that will start the drying process really quickly. And then the other thing we need to do is assess the lamb, make an assessment. Is there any reason why that lamb might not get up and suck within the next 2 hours? So has it got a big head? Was it swollen tongue, head out lambing? Was it a difficult lambing? Is it a big lamb? Has it suffered any trauma? So anything that will mean that it might not get up and suck needs addressing. And then also look at the ewe, and is there any reason why she might not get up? So is she lame? Has she suffered any metabolic disease? And you know, did she suffer any trauma during lambing? Does she need some painkiller to make sure that she gets up on her feet so that her lambs can start sucking? Because time is crucial. Ear tags can offer a route of infection. Sometimes into the lambs in some cases, so they need to be clean. So the crucial point is that surgical spirit is applied to them before they actually, at the last point before they touch the ear. So the tag can be loaded and then surgical spirit can be sprayed onto that point and then tagged into the ear, and that helps prevent infection. And other things just to consider post-lambing is applying castration and tailing rings. So we need that lamb to take colostrum in within the first 24 hours, and anything that's going to affect that needs looking at. Applying rings on will stop them getting up and will stop them sucking for a period of time. So just make sure that that isn't done within those first 24 hours as a treatment. So, going back to the slide that we saw at the beginning, lambing success is determined by colostrum, and colostrum really is gold when we are looking at where to focus in terms of neonatal nutrition and post-lambing care. So, protect and making sure we get the right colostrum and the quality quantity in there, planning for how we're going to check it, how we're going to store it, and creating records so that we can monitor, and then preventing high disease challenge, so ensuring that our sheds are clean, our hygiene practices are clean, and that we are minimising the amounts of infection that can potentially affect those lambs. And most importantly, making sure that we as the shepherds are taken care of as well. Whilst this may sound silly, we need to be well fed and we need to be well rested before we embark on what is a very busy period of the year, but the most important period of the year. So apply the plan, prevent, protect mantra to your own health, and then as shepherds you can drive forward, making sure that you have a successful lambing. If things aren't working and you have problems year on year, you really need to speak to your vet and identify where the areas are that are failing or that could be improved. Don't repeat things. Things can be changed, and it may be just a tiny tweak each year in what you're doing to improve the number of lambs that survive, and reducing the number of lambs that die. So really important to get help, speak to your vet, and make sure that you've assessed all those areas.